Q1. What is the function of the vascular system? A. Only to pump blood. B. To transport oxygen, nutrients, hormones, and waste. C. To produce red blood cells. D. To create antibodies. Correct answer. B. To transport oxygen, nutrients, hormones, and waste. Q2. What are the two main circulatory loops in the body? A. Renal and hepatic, pulmonary and systemic. C. Coronary and cerebral. D. Arterial and venous. Correct answer. B. Pulmonary and systemic. Q3. Which vessel carries oxygenated blood? From the lungs to the heart? A. Pulmonary artery. B. Aorta. C. Pulmonary vein. D. Vena cava. Correct answer. C. Pulmonary vein. Q4. What part of the nervous system controls the heart's pacemaker? A. Somatic nervous system. B. Sympathetic nerves only. C. Autonomic nervous system. ANSD. Spinal cord. Correct answer. C. Autonomic nervous system. ANS. Q5. Which blood vessels have the thickest walls? A. VEINSB. Capillaries. C. Arteries. D. Venules. Correct answer. C. Arteries. Q6. What are capillaries mainly responsible for? A. Blood clotting. B. Filtration. C. Exchange of gases and nutrients. D. Lymph production. Correct answer. C. Exchange of gases and nutrients. Q7. Which of the following does not contain capillaries? A. Intestines. B. Epidermis. C. Muscles. D. Liver. Correct answer. B. Epidermis. Q8. What condition is characterized by arterial wall dilation and risk of rupture? A. Atherosclerosis. B. Aneurysm. C. Stroke. D. Varicose veins. Correct answer. B. Aneurysm. Q9. What is a common cause of heart attack? Due to blocked arteries? A. Anemia. B. Varicose veins, atherosclerosis. D. Bradycardia. Correct answer. C. Atherosclerosis. Q10. What do varicose veins typically result from? A. Excess blood cells. B. High arterial pressure. C. Incompetent valves and veins. D. Bacterial infection. Correct answer. C. Incompetent valves and veins. Q11. Which vessels return deoxygenated blood from the body to the heart? A. Pulmonary VEINSB. Systemic veins. C. AORT. AD capillaries. Correct answer. B. Systemic veins. Q12. What are sinusoids? A. Enlarged arteries. B. Blood clots in the brain. C. Wide irregular capillaries found in some organs. D. Dilated veins in the leg. Correct answer. C. Wide irregular capillaries found in some organs. Q13. What is the role of phagocytic cells in sinusoids? A. Hormone transport. B. Waste removal. C. Blood pressure regulation. D. Phagocytosis and antibody formation. Correct answer, D. Phagocytosis and antibody formation. Q14. What is a portal system? A direct connection between arteries and veins. B. A system with only one capillary bed. C. Blood passes through two capillary networks before reaching veins. D. Lymph drainage route. Correct answer, C. Blood passes through two capillary networks before reaching veins. Q15. What is the main vessel of the hepatic portal system? A. Renal artery. B. Pulmonary vein. C. Hepatic portal vein. D. Inferior vena cava. Correct answer, C. Hepatic portal vein. Q16. What is the primary role of the lymphatic system? A. Oxygen transport. B. Protein synthesis. C. Immune defense and fat transport. D. Hormone secretion. Correct answer, C. Immune defense and fat transport. Q17. Through which structure does lymph ultimately return to the bloodstream? A. Coronary sinus. B. Pulmonary artery. C. Thoracic duct or right lymphatic duct. D. Superior mesenteric artery. Correct answer, C. Thoracic duct or right lymphatic duct. Q18. What is the function of lacteals in the small intestine? A. Absorb carbohydrates. B. Absorb proteins. C. Absorb emulsified fat. D. Secrete bile. Correct answer, C. Absorb emulsified fat. Q19. Which of the following structures contain valves and appear beaded due to constrictions? A. Blood capillaries. B. Lymph nodes. C. Lymphatic vessels. D. Arterioles. Correct answer, C. Lymphatic vessels. Q20. Which areas of the body lack lymphatic? VESSELS. A. Intestines and lungs. B. Liver and kidneys. C. Brain, spinal cord, eyeballs, bone marrow. D. Skin, fat, and muscles. Correct answer, C. Brain, spinal cord, eyeballs, bone marrow. Q21. What is the function of lymph nodes? A. Secrete digestive enzymes. B. Produce red blood cells. C. Filter lymph and produce lymphocytes. D. Absorb water and electrolytes. Correct answer, C. Filter lymph and produce lymphocytes. Q22. What is the composition of lymph? A. Only water and red blood cells. B. Only bile and electrolytes. C. Water, proteins, fats, and lymphocytes. D. Mucus and hormones. Correct answer, C. Water, proteins, fats, and lymphocytes. Q23. What is chyme? A fluid absorbed in lymph. B. Hormonal secretion from the pancreas. C. Semi-liquid food mixed with gastric juice. D. Digestive enzyme from the liver. Correct answer, C. Semi-liquid food mixed with gastric juice. Q24. In which part of the digestive tract does most digestion and absorption occur? A. Mouth. B. Stomach. C. Small intestine. D. Large intestine. Correct answer, C. Small intestine. Q25. What is the main function of the large intestine? A. Protein digestion. B. Vitamin synthesis. C. Water and electrolyte absorption. Feces formation. D. Lymphocyte production. Correct answer, C. Water and electrolyte absorption, feces formation. Thank you for watching.